Okay, good afternoon, everybody. I would like to welcome Professor Anand, who will share his experience in homeopathy in prevention and treatment of ASD.
See, first of all, I would like to thank the organizer, especially the madam, for untangling the autism. So I'm going to take only very minimal time. I'm not going to teach, or I'm not going to give a big lecture, or I'm not going to do anything which you feel boring, because as a teacher, we know last session, last day, after lunch is a challenging task, but let me try to do my level best. Okay. First, let me introduce myself. Basically, I'm a homeopath. First, as you know very well, when it comes to the treatment, globally, the best treatment is from modern system of medicine, that is allopathy. Today, as on today. But always know, there will be second or third. As per WHO, World Health Organization, homeopathy is a system which has originated from German, and it has spread all over the world because the language is English, because now the TCM, the word is very familiar, globally traditional and complementary system of medicine. Every country has got their own treasure, but it is in their language. Thai medicine, Ayurvedic medicine, Siddha medicine. But since it is in English, the homeopathy has spread all over the world. Almost 44 countries it has been used. Almost 13 countries it has been recognized. And I am proud to say that I am a homeopath. Again, when it comes second, why it's second? Because always there is a scope as well as limitation for any system of medicine. When it comes to the handling disease, as you know very well, lots and lots, majority of the disease has been treated, cured with modern system of medicine. But when it comes to the surgical disease, yes, definitely a surgeon is having an answer. Whereas nowadays, we come across a lot of disorders. The simple word, many people, lay people, definitely here, who are all sitting, they have very good knowledge. When it comes to the disorder, it is not a disease at all, like a BP and sugar. You cannot expect a cure or a magic. It is a disorder on its own. We need to bring back as much as closer to the normal. So when it comes to the disorder, whole world is struggling right now to treat hypertension and sugar, because lifetime medication, fund allocation, and number of cases is increasing. So my simple point is here, after BP and sugar, now globally, autism is coming up in third. Globally, it is not in India. As per the study carried out in America, it was once upon a time, 1780s, it was 1 out of 1,500, 70s to 80s. But 2018, it has come down to 44, and 2020, 36, everybody knows. But as on today, in my experience, I'm telling you, it will be 1 out of 20. Even today, the child born 1 out of 20 could be autistic. So here, a lot of mothers are sitting. I would like to know how many mothers are sitting. Is it 10 mothers at least? Can you raise the hand? Because they are the people who can witness my experience. Probably, I think, 10. Here I'm going to share nothing but my clinical experience. When it comes to the... I can use this mic, no? Mic. This one. When it comes to the experience, is very simple. You go to the book Corona, just only few pages. Go to the Google, go to artificial intelligence. Corona is not more than half page before it started hitting the world. But now, Corona, we can conduct 10 conference, minimum 10 conference, because We have gained a lot of experience. So the experience gives little clarity in detail. So here I would like to share my knowledge, which I have come across around 2,000 autistic kids. And the basic difference between other doctor and my approach is simple. I don't see the patients. I don't see the patients, basically. I interact with a mother. I interact with a mother. Just I interacted with a mother. I try to find out why your kid is autistic. Because as on today, even Elon Musk is working to improve the treatment. There is no diagnostic tool available apart from that assessment. Even artificial intelligence, some tools have come. University of Philadelphia came out with one camera. Within 2 to 3 minutes, people can diagnose autism. Majority of the mother, the first drawback comes there is, mother is not ready to accept that her child is autism. So to convince, now we have artificial intelligence. Indian Institute of Technology, Kanpur has come out with one small software. By uploading your kid video, 2 minutes it diagnosed. These are all with basic with ergonomics. So why I am sharing all this information is now whole world is working towards autism. So when it comes to the untangling of autism, so the understanding of autism is very important in order to prevent autism. So here all the mothers are the victims. We are suffering. Already we people are finding a lot of difficulties. So we need to have a clear roadmap how we should go further, at least to prevent autism as well as to existing condition to improve. So my point is very simple in this image. Google says keloid. It is not about autism. Just see the boy image face, first face and second face. It is a case of keloid, which is on the face. And second image, the keloid is disappeared. Here, the Google itself says keloid cannot be dissolved, cannot be treated. But the evidence has shown that keloid can be dissolved with homeopathy. This is a simple message which I got it, that we need to work on the area where we have limitations. So when allopathy is giving good results, they will be having little on limitations on the prescriptions, like autism. Yes, we have very good medicine, risperidone, Cognicare, L-carnitine. Lot of medicines are there. In India, there is an institute called as National Institute of Mental Health Science in Bangalore, St. John's Medical College. We are having a workshop of pharmacology. There was a very good improvement, but a lot of side effects are there. Because of that, they don't prescribe, psychiatrists. So they go advise only accept autism, parental care and therapy. This is where the people are stuck. There is no clear road. So this is the one area where it has shown me a vision that we can work on autism. I started working. This is an evidence of keloid. After 10 minutes, I will show you the evidence of autism. The image, what I'm showing is an evidence of keloid. After 10-15 minutes, I'll show you just 10 minutes of the evidence which I have seen with my own to you by videos. Coming to the basic understanding, the cause of autism. If you ask any mother, even today also I interacted, many of the mother here, wherever I go I interact. Nobody is very confident about why their child is autism. They will talk what is there in the book. This is there in the book. Someone say genetic, someone say it's karma, someone say vaccine, someone. But in my experience, I'm telling you, if it is a genetic, which is just 2 to 3%, yes, but that can be neutralized by doing an assessment, second trimester, Down's anomaly, double marker, triple marker. We can go for medical termination of pregnancy. So this is a message to the mother already having autistic kid. If they want to go for a second child, they will have fear. Will my second child is autism? Be confident, you can go for a second child. Because now the science is improved, we can identify autism by doing investigation, and even the nasal bone size, we can able to measure and we can go. So one message to the audience always I say, if one child is autism, don't have fear. You can go for a next child. And the next child could be a therapist for the first child. If child increases, grows, the second child will take care of the previous child, and he might be the therapist. So this is one message. Then, I strongly believe the child brain develops from the month of 2 till the labor. So we need to focus on that area. Many people are ignoring that. The day of conception till the day of delivery. So the day of conception, first, any women, epigenetic factor, environmental factor is very, very important. Now a lot of IT couples in US are getting autistic children just because of too much of stress in the job, lack of love and affection from the husband. So the pregnancy period is, which is very, very important. Country to country, the causative factor changes. Some country, I don't want to name, policy is making autism, government policy. Some country, lack of knowledge. Some country, awareness about labor process. Some country, labor complication. So we need to, if you go in detail, every country we can differentiate it. Now, of late, the stress during pregnancy is increasing among IT couples. So, first, genetic, we can neutralize it. Second, the time when they are conceiving, the epigenetic factor, environmental factor should be good, like majority, joint family, too much of psychosomatic stress. So we divide, I personally divide the mother mental health into 2. You might be, whomever the mother sitting here, if you go through my narration, any one factor could be your child. That's the reason I'm going one by one. So from the day 1 till the day of delivery, you divide your pregnancy period into 2, physical health and mental health. Both are very important. Coming to the physical health, first trimester, small mistakes happens, like not taking iron tablet. Previtals and multivitamins have been given, country to country it varies. Some people are not taking iron tablet, that could lead into lack of development of umbilical cord, number 1. Then, second trimester, if there is a genetical, we can neutralize it. The crucial factor comes on the third trimester. Monitoring your thyroid value is very, very important. Some people just they ignore by doing once in 3 months. Some people are not monitoring because they think thyroid is not important. Thyroid imbalance could create lack of supply of oxygen to the brain. Low sugar level could create lack of supply of oxygen to the brain. So overall, my topic will go only to 1, lack of supply of oxygen to the brain. I'm not a person who is going to talk about hyperbaric oxygen. I'm telling you now itself. Because the moment if I say oxygen, people are going to the next level. No. So the lack of supply of oxygen, what are the causative factors for lack of supply? There is thyroid, then diabetes, then psychosomatic stress, as I was telling you. And when it comes to the third trimester, here in US, there is a lot of program to create awareness among the pregnant women how the labor process will be. Some of the countries, we are not focusing on that. So we need to educate what things will happen, how things will happen, what is the labor process, and till the delivery, we need to explain. There, what happens? If there is a cord around the neck, umbilical cord around the neck, the people tend to ignore. You cannot ignore. Then a mother should be very careful. Mother should be mentally free to discuss with the baby. The baby movement should be there. You have to witness the baby movement. If you are not witnessing the baby movement, then consult your gynecologist. People with a hurry or with a good job, they don't focus about they are pregnant. They forget many times they are pregnant third trimester. So we need to spend real good time with a baby and find out if there is a lack of supply, definitely there will be dip in the heart rate. You go to the gynec, they will check the heart rate. They will put one belt, or they will give you a simple procedure thread, and they will ask you to put knot, or they will put you on one line. So you can rule out, is there any compression? If there is a compression, plan for immediate C-section. Why to wait till the expected date of delivery? So this is one more ignorance. Then, when it comes to the amniotic fluid level, we need to monitor that. Some people, they will have few leakage of amniotic fluid, as well as the mother doesn't drink water properly. If amniotic fluid level goes less than 8 to 18, there is a chance of cord compression. Again, lack of oxygen supply. So these three, many people are ignoring. So this could have been the causative factor for autism. When it comes to the real labor time, very important point is the doctor predict expected date of delivery. Then our mind focus only on the AEDD, not focusing on anything else. It should not be like this. We need to focus almost every week, and we need to closely monitor, especially last trimester, if there is any fluctuation in the heart rate or mother's increased BP, immediately it has to be addressed. The moment you go to the gynec, they will say there is a possibility of early C-section. And if gynec says early C-section, many of the parents, some people, I don't know whether you believe it or not, in India, because of the poverty, they are not ready to go for a C-section. They are waiting for a normal labor. In some countries, they say no C-section, wait even after labor pains 8 to 10 days, which is leading to lack of supply of oxygen. So labor process should be based on the gynec opinion, based on the data, and it has to be cross-verified multiple times to prevent autism. So if there is an emergency, we need to go for a C-section. And the lack of knowledge even with the educated woman is to differentiate the urine and amniotic fluid, water break. Many people doesn't know first time when water breaks, amniotic fluid breaks. How many mothers knows it's a water break? So by not knowing that water broke, the amniotic fluid level will go. The time when you land up with a hospital, they go for C-section and they bring it out. But they will not declare your amniotic fluid reduced or not, and they will not give you come out with a clear statement. They will take out the baby and they will give it to you, baby is normal, you come home. But only at the age of 18, you come across that. 18 months, you come across your child is autism. So these are all the areas from day 1 to till delivery. This is the reason I always interact, not like a doctor, as a lawyer, criminal lawyer, with a mother. Because many mothers try to override me, because every mother is intelligent. Every mother is, by reading a Google, internet, everybody is having their own knowledge and thought process. They don't allow me to think. So many times it is very difficult to probe the mind of a mother and bring out whether they are under psychosomatic stress or the water broke, all these things. The time of, even in India, I think once water broke, every mother has to go to the hospital, but they will give a call to the Joshir, they look for a good time. Good time, that means auspicious time. They will wait for 3 days, 4 days. I've seen. It is literally absolutely wrong. They should not do, they are not supposed to wait. They will go to the hospital after 3-4 days, even they witness the leakage. They will not reveal. Many of the current trend, they are not discussing with the elders. And the senior people are ready to, will guide, but they are not ready to share. So these are things, error, that is almost, I say, these are all human errors. Lack of knowledge, lack of understanding, even understanding also, a lot of errors are happening. So all comes to the one category called as lack of supply of oxygen to the brain, hypoxia. That is the main reason in my experience, around 70 to 80%. People blame vaccines. Yes, of course, MMR vaccine. Once upon a time, I have a clinics in Malaysia also. One of my patient father is a scientist who has done a study on this MMR. One of the company manufactured substandard mercury that could have aggravated, then it has been neutralized. Even recently, corona vaccine, a lot of vaccine has come. Some vaccine is not doing good, they will neutralize it, they will remove it. So that is the phase, only the ratio is gone high. So definitely, now MMR is not creating a trouble. So vaccine side effects, I don't find any vaccine side effect. It could be the triggering factor. After vaccine, the features will come up. It is a triggering factor. It is not a causative factor. So don't blame vaccine. It is not due to vaccine side effects. So causative factor, when you go through this, when you go to the book, these are all there. But I strongly believe many things have missed in the book, Google, even in artificial intelligence. Today you type, they will say, consult your doctor. So we need to create awareness about this cause to prevent autism. Every day child is born with too much of autism. This knowledge is very, very important to share to the community. So whomever the mother definitely would have come across any one of these areas. Again, coming to the investigation, I don't see not even single investigation, because all parents are frustrated and fed up of doing investigations. Where is the investigation to find out hypoxia? I don't find any investigation so far. You cannot go and read the women mind until unless you see eye to eye during consultation. So that's the reason I discuss with a mother. So I don't find any tools to diagnose, but of course, if at all any big organization is willing, they need to work on finding the oxygen level of a cell. If it is reduced, then it can be diagnosed. But rather, there are two signs the baby will show that I could be autism. There are 2 to 3 signs. The moment baby is born, baby would have not cried. This is one sign. Baby could have taken the Malina. When labor process, as everybody knows, the contraction starts, the baby used to come out. You ask the time of entering into the labor room, baby coming out. If there is a too much of delay, if there is a too much of pressure, and if they had used the vacuum, then mechanical compression. Again, few seconds of mechanical compression. The cervix would have not opened 10 centimeter. Baby is trying to come out. Definitely, this is mechanical error. It is a kind of an accident. Then last minute, the doctor will go for a final last minute C-section and they will take out the baby. But if baby is not cried, the people will say, no, I have listened, baby cried. You ask the next question, did they give any beating? After beating, the baby will cry. After sucking the water from the mouth, Malina, or baby could have drank that amniotic fluid. So there also there is a causative factor. If baby is not cried, then the child could turn into autism. And one more sign is, baby will not latch the milk first time. First time when baby is given a mother's milk, the baby will not latch. So these are all some early signs. The child could be autism. So now, you don't need to wait until 18 months. So now I think Google has gone with one sensory process. They will just flash the light on the eye and they will be able to rule out early around 8 to 10 months. I think a lot of research is going on. Now technology is helping us. But definitely, as you know, when the child is born, the brain develops only structurally, first 2 years. 3 to 5 years is the time where functionally it develops. Any intelligent mother will witness between 3 to 5 years. But again, people are not ready to accept initial stages because of the love, affection and care. What I do, rather asking the patient, that is kids, we can definitely categorize every autistic kid in 3 to 4 category based on my experience. There are a difference between autism and autistic spectrum disorder. Spectrum disorder is, there is a probability of moving towards autism. Autism has got all 4 spectrum, and many people think that only the ADHD is autism. It is not the only ADHD. Even if they have sensory problems, it comes under autism. Sensory, as you know very well, reaction to the light, they will be seeing lateral, and fear of sounds. Even morning, the sleep session, he was talking, no? So sensory issues will be there. Fear of light, fear of noise, fear of smell, fear of touch will be there. And we don't know why he is cranky, because his sensories will be hyper reactive, very, very hyper. And normal person, we don't realize it. So that those children are coming under sensory category. This will be useful for me to make a homeopathy medicine prescription. That's what I'm sharing this. And other category is kinetic. Everybody knows the moment once if child is not sitting in one place, fidgety, they call kinetic. So they will not sit in one place. They cannot have an eye contact, hyperactivity, sitting tolerance, all will be lacking. And another category is regressive. Many people think that regressive is not autism, and many people will have mild autism. I think everybody, whole world knows that Elon Musk is mild autism, Bill Gates is autism. A lot of certain factors, people right now have a preformed opinion, only ADHD is autism. These all good entrepreneurs are having mild autistic features. So these are the 3 categories which I divide before I prescribe homeopathy medicine. I give homeopathy medicines, as I told you in the beginning. You could have seen what is homeopathy medicine. It looks like this small, tiny globules. Homeopathy has got no side effects, no drug interactions, and it is sublingually dissolved, and it is not an invasive or any surgical procedure, just oral medication. And there are thousands of homeopathy doctors are there, but again, based on the experience, right medicine, right dose is very important. But as you know very well, every practitioner will have their own style of understanding, and until unless you find the right, you cannot come to the good prescription. And as I told you in the beginning, I'm going to share you few videos whom I have seen. I'm going to take only, this is going to be 7 to 8 minutes of 5 patients. It's 3 patients in Tamil language in regional, 2 patients from Malaysia. You could witness, I'm just sharing, you could witness how they are improvement just by observing in this video. பேர் என்ன? தக்ஷன் நீங்க ஏதாவது கமெண்ட்ஸ் கொடுங்க. தக்ஷன் பேசுங்க மேடம் ஏதாவது. தக்ஷன் catch this Dakshan after 6 months. I don't want to take too much of time. 3 months முன்னாடி உங்களோட ஒப்பீனியன் தக்ஷனை பார்க்கறது 19 months முன்னாடி உங்களுக்கு என்னென்னலாம் டிஃபரன்ஸ் நீங்க ஃபீல் பண்றீங்க சொல்லுங்க.
நிறைய பிஹேவியர் ப்ராப்ளம்.
என்னென்ன ப்ராப்ளம் மாறி இருக்கு?
Behavior
changes been improved.
காது ரொம்ப கையச்சு.
Fear of sound is reduced. Self talking reduced.
சைடிஷா பிஹேவ் பண்ணிட்டு.
Repetitive movement reduced.
Okay. எவ்வளோ பர்சன்டேஜ் கம்மியா இருக்கு மேடம்?
Percentage of improvement 50%.
இப்போ கூப்பிடும்போது ஐ கான்டாக்ட் எப்படி இருக்கு?
அதெல்லாம் நல்லா.
Eye contact
நல்லா
has been improved.
நீங்க கமெண்ட்ஸ் கூப்பிட்டு இன்ஸ்ட்ரக்ஷன்ஸ் கொடுங்க உட்காருங்க.
பேர் கூப்பிட்டா
அப்போ வந்து ரொம்ப
அதாவது ஸ்டார்டிங் 7-8 monthsலயே அவன் இப்படி பண்ணுவான், அப்புறம் சில சமயம் இப்படி பண்ணுவான்.
ஹைப்பர் ஆக்டிவிட்டி
அது குறைஞ்சிருக்கு.
எவ்வளோ பர்சன்டேஜ் ஹைப்பர் ஆக்டிவிட்டி குறைஞ்சிருக்கு? 70%.
You could have seen
ஐ கான்டாக்ட் 3 monthsக்கு முன்னாடியும் இப்போ எப்படி இருக்கு?
you can see the baby directly. Better you can witness it.
1 second 2 second வந்து பாப்பா. இப்போ ஒரு கூப்பிட்ட ஒரு
பாத்தீங்கன்னா கொஞ்சம் ஒரு கொஞ்சம் ரெஸ்பாண்ட் பண்றோம்.
எவ்வளோ நேரத்துக்கு இப்போ ஐ கான்டாக்ட் இருக்கு சார்? டாலரன்ஸ் எப்படி இருக்கு சார்?
அது நிறையவே வந்து
உட்கார்ந்து போய் பக்கத்துல
ஏன்னா தினம் ஆக்டிவிட்டீஸ் எல்லாம்
நிறைய
பண்றோம்.
ஓடினால
சிட்டிங் for nearly 2 hours எல்லாம்
உட்கார ஆரம்பிச்சிட்டோம். இஸ் குவைட் கம்ஃபர்டபுள்.
அந்த ஷேடோஸ் பார்த்து ஆடுறது அதெல்லாம் குறைஞ்சிருக்கு.
அப்சஷன்ஸ் மாதிரி ஏதாவது ஒரு பர்டிகுலராக பொருளுக்கு அந்த மாதிரி ஏதாவது இருக்குங்களா?
அந்த கிரீன் கலர் அதுக்கு ஆனா ரொம்ப முதல்ல எங்கன்னா தேடி பிடிச்சி எடுப்பான். ஆனா இப்ப அப்படியெல்லாம் இல்லை.
3 monthsல ஓவரால் ஏஎஸ்டி ஸ்பெக்ட்ரத்தில் எவ்வளோ பர்சன்டேஜ் ஒரு சைன் ஆஃப் இம்ப்ரூவ்மெண்ட் நீங்கள் விட்னஸ் பண்ணியிருப்பீங்க?
10 to 15%
15%. எல்லா ஏரியாஸ்லையும்
நான் எங்க நெகட்டிவ் வந்தோம் இனிஷியல் டேஸ்ல சோ எல்லாத்துக்குமே இம்ப்ரூவ்மென்ட்.
Do you feel homeopathy is working?
Yeah.
Because I go almost more with it will be around I think almost 2 courses of homeopathy medicines completed.
Almost
we are on
1 year.
3rd course, right?
Third course is really
So
nice.
what are the improvements you are noticing, madam?
Let the mother say.
Yeah.
His teacher was telling me that
Okay.
the latest when we go to the school day to take the report card, right?
Okay.
The teachers were mentioned that actually he now can sit down.
Okay. Sitting tolerance has been improved like anything.
Yes,
Yeah.
on his place,
Mm.
he can sit down and then doing his own things.
Okay.
Very good.
And then he will not walk around.
He will not disturb others.
Yes. No.
Irritability is reduced.
Yes.
Okay. Eye contact?
Better.
Yeah.
Mommy, I want to go shower.
Speech is coming clearly.
Yes. Mommy, my ear is pain. Like just now when he said that aeroplane on the flight, he was like, "Mommy, my ear pain already."
What
currency? You tell doctor, what currency do you want?
You want only in pounds.
This is another
ஒரு விஷயத்தை சொன்னா கேட்குறான்.
அவர்களுக்கு அது போகுது, அவனுக்கு ரீச் ஆகுது. பட் ஆனால்
என்ன பொருள் சொல்றேன்னு தெரியல.
தெரியல.
எதுக்கு சொல்றாங்க?
முதல்ல எப்படி இருந்தது? 6 monthsக்கு முன்னாடி எப்படி இருந்தான்?
முதல்ல
எடுக்க மாட்டான். எதுவுமே எடுக்க மாட்டான். எதுவுமே அழுவான். எடுடான்னு சொன்னா அவ்வளோதான். இப்போ எடுத்து கொடுக்குறான். அவனுக்கு தெரிஞ்ச பொருள் தனி போட்டு எடுத்து கொடுத்து தனி போட்டு எடுத்து
யூஸ் பண்ணுறதுனால.
மேடம் முதல்ல 6 monthsக்கு முன்னாடி எப்படி இருந்தால் அந்த ஹைப்பர் ஆக்டிவிட்டி?
பரவாயில்ல. ஏன்னா இந்த ஃபர்ஸ்ட் டைம் இங்கே வரும்போது
பரவாயில்ல. அதான் ஃபர்ஸ்ட் டைம் இங்கே உட்கார்ல வெளியில் போடுறான்.
இப்போ
இங்க வந்து எங்க கூட ஓடுவா சார். புடிச்சி தரத்தர எடுத்து தான் உட்கார வைப்போம். இப்போ கொஞ்சம் புதுசா இருக்கு, கொஞ்சம் எக்ஸைட்டடா புடிச்சிட்டு இருந்தான். ஓகே தான்.
இப்போ ரெகுலராக வீட்டில எல்லாம் பார்த்தீங்கன்னா காமா
ஸோ
வந்து
ஹைப்பர் ஆக்டிவிட்டி இம்ப்ரூவ்மெண்ட் இருக்குது, ஐ கான்டாக்ட் இம்ப்ரூவ்மெண்ட் இருக்குது, சொல்கிற விஷயத்தை புரிஞ்சுக்கிறான். இந்த இம்ப்ரூவ்மெண்ட் நீங்கள் இப்போ நம்ம ஹோமியோபதி தவிர வேறு ஏதாவது மெடிசன் கொடுக்குறோமா? ஹைப்பர் ஆக்டிவ் எதுவுமே கொடுக்குறது. ஓகே
உள்ளுக்கு மாறுறது மட்டும் தான் மற்ற தெரபிஸ்.
சாய் இந்தாங்க, இதை ஓப்பன் பண்ணுங்க. ஓப்பன் பண்ணுங்க. ஓப்பன் க்ளோஸ் பண்ணுங்க.
க்ளோஸ் பண்ணிடு. சாய் க்ளோஸ்
பண்ணுங்க.
மூடி வை.
ஃபைன் மோட்டார் ஸ்கில்ஸ் ஹஸ் பீன்
சொல்றாங்கன்றது.
ஓகே, ஒரு சிம்பிளான கொஸ்டின். 6 months இந்த ஹோமியோபதி மெடிசனில் ஏதாவது டிஃப்ரென்ஸ் இம்ப்ரூவ்மெண்ட் இருக்குது, ஹோமியோபதி ஹெல்ப்ஃபுல்லாக இருக்குன்னு நீங்கள் நம்புறீங்களா?
நம்புறேன் சார். இல்லை 100% நம்புறேன் சார். அந்த நம்பிக்கை இருக்கு எனக்கு.
உங்கள் நேம் என்ன?
Now the baby started going to the school.
இங்கே மேலே
If you
வச்சுட்டு
have continued a ADHD child or ASD child, he will not be admitted in a normal school. Now he is attending a normal school. Automatically his classmates are therapists.
ரெஜிஸ்டர் நம்பர் நல்லா இருக்கு. சரண்,
Best time is to intervene 3, 4, 5. So that 5 to 6 they can put on to the regular school. He almost looked like a normal boy. It has taken almost 2 years time. He can able to eat on its own.
அசஸ்மெண்ட் பார்த்துட்டிங்களா மேடம்? அவங்க அசஸ்மெண்ட்டை என்ன ஒப்பீனியன் சொல்கிறாங்க? அவங்களோட ஒப்பீனியன் என்ன சொல்கிறாங்க? லாஸ்ட் 6 months அவனோட ஒப்பீனியன்.
அவங்க 3 months எடுக்கிறாங்க சார் அசஸ்மெண்ட்டு. 3 monthsக்குள்ளே எதாவது கொஞ்சம் லிசன் பண்ணுறான், உட்காடுறான்.
சிட்டிங் டாலரன்ஸ் இன்க்ரீஸ் ஆகிருக்கு.
இப்போ முதல்ல போகும்போது அப்படி அது கிடையவே கிடையாது, உட்காரவே மாட்டான். இப்போ
அதுக்கப்புறம் ஐ கான்டாக்ட் இப்போ நல்லா இருக்குது சார். இப்போ கூப்பிட்டோன்னா நல்லாவே பார்க்குறான். நம்ம ரெகுலர் கமெண்ட்ஸ் கொடுக்கும்போது வா போ அதெல்லாம் பண்ணும்போது உட்காரு அதெல்லாம் பண்ணும்போது பண்ணுறான். இது அதை எடுன்னா போகிறான். அந்த விஷயத்துக்கு போகிறான். எடுக்கணும்னு சொல்கிறாங்க, அதை எடுக்கணும் அப்படின்னு.
Now technology is helping. This is after Corona. I started working globally through Zoom consultation. Patient sitting in Malaysia, I am sitting in India.
இது ஸ்டாண்ட்ஸ்லேருந்து குதிக்கிறது அதெல்லாம் நிறைய ரிடியூஸ் ஆச்சு. என்ன அந்த ஜம்பிங், இந்த ஓடுறது, ரன்னிங் இந்த சர்க்கிள் அதெல்லாம் இல்லை. போய்கிட்டு வந்துக்கிட்டு, பட் நாட் லைக் ஜம்பிங் லைக் தோஸ் டேஸ். அதெல்லாம் ரிடியூஸ் ஆச்சு. ஐ கான்டாக்ட் சூப்பர். சிட்டிங் டாலரன்ஸ். இப்போ நீங்க ஏதாச்சும் ஒரு ஆக்டிவிட்டி கொடுத்து யூ ஆஸ்க் ஹிம் டு சிட் அண்ட் டு, ஹி வில். அது 30 minutes இருந்தாலும் சரி, 45 minutes இருந்தாலும், both of them now they can mingle around, they can wait for the turn like they are passing ball and playing, right? So they understand and the rule, or you have to wait until the ball reach you. You cannot move, you cannot go and grab it. So they start to have this understanding.
How is this food habit? சாப்பிடுறது காலையில மதியம் நைட் 3 வேளை டைமுக்கு சாப்பிடுறாரா?
அதெல்லாம் சூப்பர்.
ஓகே, chew பண்ணி சாப்பிடுறாரா? whether he can able to chew the
now perfect chew. Before this முழுங்குவாருங்க ரொம்ப.
So now this technology is helping us through, he's an assistant in Malaysia. So what I do is, it's only just few glimpses, no. I don't make any animations or additional language because it's a raw video which is taken in my clinic. Now Zoom is helping us. Just we can record it before treatment and after treatment because people are not ready to believe whomever says that we can, I'm not curing autism. I'm not assuring or I'm not telling that anyone I'm curing autism. We can find an improvement. This is what my statement always. So based on my experience, I conclude that definitely yes, we can witness the improvement within 90 days of homeopathy medicine. And my protocol is very simple. 30% of the treatment is based on the mother's hand. Mother is a good therapist, mother is a good teacher. Second comes therapy. Yes, definitely. 2 days you have been going through multiple, you are getting a lot of knowledges about therapies. Every conference, every symposium, every workshop is very important for a mother. I could see every mother is traveling everywhere to get the knowledge, and that is the one which is really helping to improve. And I give internal homeopathy medicine which has got no side effect, drug interaction, nothing, and just for a period of 90 days. If they witness the improvement, see ultimately the signs of autism, if there is an improvement, I don't ask the patient that, don't ask me the improvement. You ask your parents, you ask your teachers, you ask your neighbors, and you ask your therapist. If they feel there is an improvement, you believe, because every day you see, even as a mother, you cannot see the improvement. Now I'm going with 4 assessment. One is, again, yes, now we need to come to the scientific forum also. We have an assessment tool, Indian Standard for Autism Assessment Tool, which before treatment, after treatment, I take the assessment, and I ask every parent to take 1 or 2 minutes video, and I ask the therapist report and compare the report. So by this, I've been handling all the cases. See, these are all the videos. If there is a one-day workshop for the doctors, I show all the videos. These are all almost nearly across 2,000 cases. All these parents. When I started witnessing with my own eyes, I wanted to create an evidence. So that is what I said, keloid. I showed, even I have not believed that keloid I can cure. Now with these videos, even I am witnessing, yes, definitely homeopathy can show some results with autism. This is some study which I have carried out by my college research center, and mild degree, moderate and severe degree, and T value, P value, you could see there is a good improvement. In this we have taken just 60 kids as a sample, and overall pre-treatment and post-treatment, mild, moderate and severe, we divide based on the ESA app category. And outcome, almost you could see percentage of cases, worsening 3.33, status quo 8.33, mild improvement 26.67, moderate improvement 35%, marked improvement 26. This is what I always say. It is not only homeopathy is helping. Each and every conference I say, it is not only homeopathy. Definitely speech therapy. I'm not a therapist, but I always recommend, if speech is set back, you need to consult a speech therapy, occupational therapy, physical therapy, sensory integration, auditory integration, and vocational. And I want to highlight in this two. One is stem cell. Another is hyperbaric oxygen. Stem cell, I think Dr. Alok Sharma would have given a detailed explanation yesterday. And he is the person who is doing wonderful job in stem cell. Again, it has got little limitations because brain cell is different, bone marrow cell is different. And that is a procedure. A lot of ethical committee, advantages are there, disadvantages are there. I leave it to the parents. And hyperbaric oxygen, I think definitely, yes, it is worth of driving. It is nothing by scuba diving. Everybody is going for a scuba diving, right? Hyperbaric oxygen is nothing but a scuba diving. So keep your children in an oxygen chamber. And ultimately I ask older people to sit along with, because once you sit in the hyperbaric oxygen, it helps to get the good oxygen so that anti-aging process will be good. Everybody look to live for a longer. So hyperbaric oxygen is one more option that can be combined. These are all comes under auxiliary measures. So I give internal homeopathy medicine just for a period of 90 days. And I don't take too much of time. First of all, based on my experience, I limit myself that I don't want any new investigation. I just take 60 minutes to understand why your kid has become autism. Then just give medicine for 90 days and come to the conclusion whether it has helped or not. If it has helped, I will definitely recommend for a period of minimum 1 year, maximum 3 years. And these are all some references which I have taken, which will be useful for only the study. And key takeaways. My experience indicates definite reversal of score in autistic after homeopathy treatment. This is what my message to the audience. Thank you. Any questions? Yes, definitely. And I think 10 mothers have I'll probably. How many of you accept my experience on causative? At least one or two.
Yeah.
How many of you say, yes, my concept is right? 1, thank you. 2, thank you. 3, 4, 5, and pass. Let me do my own assessment, no, rather giving. See, again, this gives me a boost for me, because I'm not with too much of knowledge in all, but again, my concept is helping. I strongly believe if you go through the reverse, we can prevent autism. Preventing is easy way. So educate the mother, government policies, create awareness. Bahrain is a small country with only 15 lakhs population. We can make it zero down another 3 to 5 years if you are going to create awareness. Already you are suffering. Yes, fine. Whole economy, your family, mental health is suffering. Forget about the money, forget about the caste. Mental health has been disturbed, full family has been disturbed. So let us keep autism-free Bahrain. This is what my message to the organizer, because country like India, we can't work. My Chennai population is, Tamil Nadu population is population of Malaysia. When I go to Malaysia, again there a lot of drawbacks are there. UAE, lot of drawback. So when I landed in Bahrain, first time I went to Bahrain, 15 lakhs, yes, we can make autism-free Bahrain. Some movement, someone has to take initiation, autism-free Bahrain. I'm not talking take homeopathy medicine. Try to prevent the cause. Then you see the statistics will come down. Show to the world that Bahrain is front runner. Just my simple, with this message I conclude. I'm ready to take the questions.
Thank you, Doctor, for your informative session. It's clearly that awareness is very crucial, and lack of awareness could be a cause for many cases. Probably most of the cases developed further because of lack of awareness, whether in this part of the world or in the other parts. My question is regarding, actually there are two questions. Can genetic engineering through DNA editing help to prevent or eliminate or reduce the new cases? And the second question, there are scientific research recently proven that gut bacteria or gut microbe could be a reason for causing the autism. So transporting or transplanting the bacteria into a good bacteria into the body, can it help? Thank you.
It was a really excellent question, all three questions. First point is, I missed out one point, awareness. It looks so funny. People think that by seeing internet, by seeing gadgets, kid has become autism. Myth. It is not by gadgets. Some people think that when you take iron tablet, the child will be black so that they have not taken iron tablet. Again, myth. Yes, I was laughing many times. Okay, so these myths can be ruled out by awareness. This is my add-on points. First question, very important. Sir, I'm strongly believing only 1% is genetic. I respect your knowledge on gene. Even the same question is asked by the census organization in Palm Jumeirah. If there is a gene, okay, let's talk about 1%. By screening, this is what prevent autism. By screening a mother, double marker, triple marker, and development of bone during 5th and 6th month, we can recommend medical termination of pregnancy is my answer. But again, coming back to your question, recently I interacted with one person who is doing research on gene. They are doing research on cancer, not on autism. I asked that lady, same question, madam, any studies do you have on autism? Then she said, yes, we have done. It is not through gene. I will share you the details. I will share you the concerned person number to the madam because they don't share all secret information. They're all corporate people. They're all very big people in Maharashtra. I will share the number. Definitely, I strongly believe it is not through gene. If it is through the gene, we have been studying on cancer. So when you go to the cancer, again square cell. When the cell breaks and becomes cancer, you go on life space analysis of psychosomatic stress is a cause. Again, inside the cell, there is one energy. That energy broken because if mother is going against nature, every life there is a nature as created. If you go against nature, the child breaks. So I don't think so. First number, answer the question is, it is not due to gene autism. If it is gene also, we can prevent by creating awareness and removing third trimester. And if you want the details about more on gene, I will share you the details. Few of the scientists, because a lot of my patient fathers are scientists, they are expert in that area. I can share you can get the details. If it is for the genuine cause, they will share. And if I get, definitely I will share you. And the last question, that is regarding the gut. Yes, definitely gut has got direct relation with the brain. It is not the causative factor, it is the maintaining factor. Brain has got connected with the gut through vagus nerve. There are 3 products which already science has proven. If you give to the children, milk in any form, goat milk, cow milk, any milk, you name any milk, chocolate, choco in any form, wheat in any form, that could go and trigger the gut, it will be worsened for a short period. So, yes, we need to deworm every 3 months in my treatment protocol itself. I will ask the mother to clean albendazole, tenidazole, bandy. So ask the mother to do every 3 months. Generally, pediatrician will say every 6 months. So we clean the stomach. And in Ayurveda, there is a procedure for cleaning the stomach. In traditional complementary system, every system has got cleaning the procedure. You have your own tradition also if you go through your tradition of your history, you will have yes, fasting. So every religion has got certain protocol which is scientifically proven. So yes, gut is directly related with the brain. It has to be cleaned properly. Last conference in Bahrain, one person was sharing the knowledge that virgin coconut oil, drinking 5 ml. So everybody comes out with a new concept. Finally, they'll end up with one commercial product that I don't respect. But gut is directly connected. I always say, whatever the way you feel clean the gut, that is directly, it will be a triggering factor. It is not the main causative factor. Main cause is the brain cell. So we have trillions of cells. The brain cell developing from age of 3 to 5 with axon and dendrites and synapses connects. If you are losing the 3 to 5, then slowly if you do MRI or PET scan, you can see the ununiformity in white matter and gray matter. That is because of losing the contact. So the main area where we have to address is cell of the brain. Gut is, yes, associated factor. We also should advise, a lot of theories have been coming up. So I don't want to go all this topic detail because I don't want to become a master in anything. Let me be a master in only homeopathy because it is like an ocean. Even morning, one take-home message I got it from morning session, sleep, which is very important. In India, malalite or malaise? No. Some drugs have started appearing, sleep tablet. It is melatonin. Yeah, it is readily available in the market now. So suddenly, if you take any gut-related problem comes, 2 days of melatonin is solved. Let your child sleeps, clean your gut, you will be all right. So this is how I am getting all the messages from every conference, even from Bahrain I am taking one message, melatonin. Because being a homeopathy doctor, I don't recommend. But nowadays in India, market is big. It is available in the market. So I can definitely recommend as a doctor. And in Malaysia, I got one information that is for a speech, cannabis indica. Application of cannabis indica on the tongue really helps for speech. Many mothers say, but it is illegal. So now, as a doctor, can I share this or not? Can I give cannabis or not? Again, court of law. But again, with confidence, I am doing with the logo of Dr. Vijay's Autism Clinic. I have been sending all the medicine, 13 countries, right from customs to the government. When it comes to the autism, they just give exceptions. I got this message also, cannabis indica, even in homeopathy. If you could have seen nobody asked the question. I think, yeah, just a minute. I showed you the medicine name, homeopathy. Have you anyone witnessed that name, cannabis indica? See, I've given. See, first name. Homeopathy, cannabis indica, but I understand because this is not a crowd for homeopathy. And the cannabis indica, again, we cannot officially promote. Homeopathy, we don't use raw material. We dilute, we go beyond nanoparticle. So even if you give to the customs, almost 13 times my medicine has been cross-checked in US FDA. Why this 200 patients I am sending? How come this medicine has been very popular? 13 times they were not able to rule out even one cannabis indica in my medicine, which is really a cannabis indica. It is immaterial, it is nanoparticle. And cannabis indica is available in, I think, Thailand. It has been approved. Some companies are working. Amazon, some company, they are selling. But again, no, madam, when you transport, no, if it is there. Cannabis, cannabis. External. Again, the dose should be very careful. Cannabis cannot be dissolved with water. Cannabis cannot be dissolved with milk. Then how are you going to give? No. I'm not talking about the different pleasure of cannabis. How we can give to the kids? Mix with honey. One drop of cannabis indica mixed with 3 good honey because solvent and solubility. Cannabis can only break downs on that. And you know why the medicine is applied on tongue? It is not for speech. Why? People think speech, tongue. No. No? No? Where you take the sample for DNA test? Why? Why? Not easier. A lot of DNA RNAs are there. It's not easier. No. That is not the reason. DNA RNAs are there. More RNA DNAs are there in oral cavity. You go for any test, they go oral. Homeopathy has given orally. See, these are all some signs which we need to correlate. So it's almost traveling almost 10 years in different country. I get a lot of tips. So just I'm sharing the tips. Cannabis indica you can try. In India, one company has got approval to manufacture cannabis indica, which is readily available. I think one company in Rajasthan. Yes. So when it comes to the child, no. But a country, I think Malaysia, we were discussing about cannabis indica. Then ultimately that Deputy Prime Minister was there. If that is the case, we will patronize it. The moment once we share any information, patronization. So we have been working in Malaysia. I think a lot of areas, cannabis indica is helping medically to treat the cancer pain. People are going to die. How can you make them by giving chemo, radio, rather let them be happy. They will live longer. You go chemo, radio, go against nature, you die sooner. You do the comparison. A person who goes with too much of chemo, too much of radio, die faster. Rather, you be there in somewhere in deep village, no medical help, you will be healthier. You will be healthier, including cancer. So, these are all my experience. You can try for speech, cannabis indica. Homeopathy, cannabis indica, 200 potency. That means 1 by 10 to the power of, you put 400 zeros. Then the people say there is no material. Homeopathy, people say placebo. Homeopathy, people say unscientific. Yes, we are unscientific, but time tested. Time tested. We don't have a proof, but this is the proof, clinical evidence. What else I can now? Mother is ready to accept. Now I got many people ask, how you have seen 2,000 kids? It's only by Google review. Professor Google is helping me. I cannot go and put my review on Google. It will validate and neutralize it. Google reviews, just type Dr. Vijay's autism in Google. Every parent will give their honest opinion. Now you cannot cheat the people. You cannot fabricate. Whether anything is good will come up. So rather wasting on time towards the research, I try to convince the mother. I try to prove that homeopathy is helping. And this is my approach. And early intervention, I can make a mild autism kid into normal child. So this is my experience. I think I answered all three of your questions.
Thank you so much. Yes, you did. Thank you. Thank you.
Hello. Thank you very much for your discuss, because I'm mother and I see that all what you say, I have it when I pregnant. And now the difficult question that you said that the major and main person can help the child, that's the mother. Then if I have all this depression and working, and the family depression also, and the people depression, they said that this baby is not normal. How I can help my child? Because I see sometimes I abuse them because I'm tired.
Yes.
I need somebody to help me. So yes. What's the main thing can I help myself to help this baby or this child?
First of all, already you are helping, madam, by spending too much of time sitting here and listening. Again, you are not listening for yourself, you are listening for your child. So your intention is to help your child. Keep doing it. First, environmental factor. You need to get support from the environment. Already you said you are already under little of stress. See, the point is we are not bringing them closer to the normal. At least first half of life is taken care by the parent. Second half of life, they need to stand on their own. Let us try for small things and let us do whatever the best we can do for the child. Since you said you are not in a position to help, I don't think so. You definitely can help. Moving forward, a lot of therapy centers are there, a lot of social service organizations are there. we need to create some kind of a concept. I think in Malaysia we have started with a autism cafe project, that is to start run cafeteria where a lot of autism children will come. They are going to do small jobs. And we brand that, yes, autism. Ultimately, when they start making little money, they get recognition from the society. So these are some small projects with social service organization. You can look forward. And moving forward, as you rightly said, we need a family support strongly. I definitely agree that it is an obstacle for you, and your love and affection is doing good, and keep doing it. Don't lose your hope. You can try. And I honestly say, don't have real good suggestion, because a therapist could be the right person to answer your question. I don't have such experience, honestly speaking, but I always say try homeopathy medicines to keep him calm. Don't expect magic. You can try homeopathy medicines.
Hello, sir. Can you hear me? Yeah. Hi. My name
Yes.
is Sausan. I'm mother of a young autistic man. I have a comment and question, if I may, about the genetic. Going back to this, I know it's very problematic, but I've noticed from my own observation that the number, you tend to see more kids on families. Basically, like in some extended families, they tend to have more autistic kids. So it indicates there is kind of genetic relevance there.
I strongly agree with the point. Genetic relevance will be the reason. But so why not we have a close monitoring?
Yeah. So
we can go for MTP. If you are ruling out medical 6th trimester, you can go for MTP. Medical termination of possibly is possible. No. We can able to clearly pinpoint by developmental analysis during 6 months. If it is genetic. If it is genetic, just better go for why you have to wait? And I strongly believe when doctor says baby is normal, then again you are talking that gene is the reason. I want you to have a clear green signal from your gynec. I am not the person. If you feel that your genetics having, yes, have a close monitor, go to the gynec, take 2 to 3 opinion. If everybody says your child is not autism, then why you want to go for MTP? Then again, why you want to go say that it is due to the genetics? If it is a genetic, we can rule it out. Definitely, yes, now the science can rule it out. This is what we need to create awareness. Awareness among the mother. Definitely, yes, 3 to 5%, yes, it is there, it is there. Yeah. It is there, but why they are continuing if it is genetic, if Downs is positive, if double marker is positive, if nasal bone is more showing towards autism, the score will get, then you go for medical termination. That's abortion. Any gynec will suggest, officially it has been done. Not autism. Not autism. See, if any genetical anomaly is there, the gynec will say, better not to carry the child. See, our aim is, knowing that it is genetic, then why should we go to the till delivery?
No, but if it's genetic predisposition that gets triggered by, for instance, vaccination, so then we need to invest in vaccination.
Vaccine will not help in gene. Gene is created by the God.
You know, if it activates it, if it's, what I'm trying to say, there are studies that suggest, okay, if there is genetic predisposition and gets triggered or activated by the vaccine that has thimerosal in it, this chemical preservative, then we need to be educated about the content of the vaccine. I mean, for instance, what I did with my son, I noticed the changes after the vaccination. So when I had my second child, I had to order the vaccination.
After child is born? After
2 years.
After 2 years, right?
Yes, exactly.
I'll tell you.
After the MMR vaccination.
I'll tell you. Many mothers, even I strongly agree. There will be a history of genetic. But definitely it is not due to the genetic. But you have a predisposed mind that it is due to genetic. Maybe other areas go through, definitely hypoxia could have been there. And 18 months to 24 months, it starts triggering. It triggers with vaccine. I agree that it will trigger. It is not a causative factor.
Yes.
So, the person who strongly believes it is genetic, go through the data analysis, it is not to the genetic. Maybe some other reason could have been there. Even in your case, you go through, sit and go through all other parameters. something could have triggered, and vaccine could have been the triggering factor. Yes, high grade of with fever with epilepsy will trigger autism. After the fever, the child will start showing more symptoms. Before that, there will be a less symptom, which you have not witnessed it. This is what my point.
I think my second question was about the homeopathic. I don't know if you have time for that. Is how long it takes?
Just 90 days, madam. It's a very simple protocol.
There is a specific protocol for it that needs to be.
Which I shared, very simple. I take 1 hour of discussion with mother. First, let me understand whether it is gene or causative. If it is a hypoxia cord around the neck or labor complication, and that we will understand how much level it has taken. Many people, they would have gone to the NICU, they could have given oxygen, it is not sufficient. So some child would have taken a Malina. So we need to go through the details, and intensity of the autism, it takes 90 days. We can see improvement 10 to 20% minimum for any child for autism, any level. I assure 10 to 20% minimum improvement. If they are not witnessing it, I will say better not to continue. If you witness it, you continue. Simple. Because I know every parent is struggling, nook and corner, going here and there and doing all investigation, all therapies. It's a simple procedure. Zoom consultation, 90 days medicine, review after 90 days. Simple. Share your opinion on Google. Simple.
I mean, if my son is on certain medication, would that affect the homeopathic treatment that he might...
No side effect with any other medication, whatever you are going to give for your child, number one. Whatever I am giving is to brain cell neutralize the oxygen regeneration therapy, not a supplement therapy. During 90 days, any cold, cough, fever, anybody will come across. Give whatever the medicine you want. Like cardiologist will prescribe only BP medicine, will not prescribe any other medicine. Even you go to the common problem, cardiologist will say, no, I am touching only heart. Why? Because we are dealing with a precious organ. We don't want to get prescription confused with other small areas. Just keep your hands tight for 90 days. What we do for a diabetes, take medicine for 3 months, HbA1c. Out of 90 days, you take diabetic tablet also. When you take sweets, it gets fluctuated. Even you take BP tablet, when you have stress, it gets fluctuated. So every 90 days we review, no side effects, no drug interaction. Homeopathy has got 290 years we have crossed. People say it is placebo. Let it be a placebo. Even if placebo helps for your child, let it be.
And over these 90 days, sorry I'm taking so much time.
No issues.
Do you have to see the patient regularly, or it can be...
I am not seeing a patient at all. What is the point of me to see the patient? You bring a patient, what I am going to do? I am not going to use stethoscope, or I am not going to send you for a... Your observation. First consultation, mother. Second consultation, you ask your teacher, your neighbor, your therapist. I don't need mother, but I take 1 or 2 minutes video from the child, mother, because I will see the height, weight, gait, to understand better. Just 1 minute of video is enough. Even you bring your children to the clinic, I am going to observe 1 minute or 2 minutes. That's all. Now technology is helping, sir. That's it. Simple.
Thank you very much, Doctor.
Thank you. Thank you. Thanks for the opportunity.